Alrighty, well, good morning, everyone. It's great to see such a lovely room with many of you here today. We appreciate you coming out and being willing to learn a little bit about cancer prevention in Boston. Throughout this presentation, I'm going to be talking about Boston. I know obviously today we're in Quincy, but the reason why we talk about Boston is because every 3 years we sort of collect data about the residents of Boston, sort of what health disparities exist in the state, how cancer trends are looking. Unfortunately, we don't have that data for Quincy specifically, but we hope some of it still is applicable, and some of the more broad topics I'll be talking about, of course, are applicable to anyone from any city. So just wanted to introduce that before I get started. And my name is Anisa. I'm not sure if I introduced myself formally. I work as a community outreach specialist at the Community Health Office at Dana-Farber. And the Community Health Office is a department that specifically is focused on lowering cancer risk among our communities, especially those that are marginalized in Greater Boston. So we really approach things through a health equity and social justice lens. So just to give you all a quick glimpse of our agenda today, we're going to start first by talking about our understanding of what Boston is, and then we'll get into sort of the health behaviors, the things, the decisions that we can make every day to sort of look after our health. We'll then talk about sort of the cancer rates in Boston, thinking about cancer screening and things of that sort. And then we'll end with some of the programs that we have at Dana-Farber to sort of address some of the realities that we see around the community. So throughout this presentation, as I said, we're going to be talking about Boston. So in order to ensure that we're all approaching this with the same understanding, I thought I would just quickly showcase a slide that describes who Boston is. So as we all know, Boston is a vibrant city that's very culturally diverse. We have people from many different backgrounds. More than half of Boston's residents identify as people of color, with almost 30% of the city having people born in countries outside of the US. And about 1 in 3 people in the city also report speaking a language other than English. Since our conversation today is focused on health, I know this seems kind of like a funny question to be asking you all, but I wanted to get your engagement in this presentation. So I thought it would be nice just to ask you all, when you hear the word health, what does that mean to you? Maybe if people want to raise their hands or shout it out, we can hear a couple of different perspectives. Yes, please.
Health is your responsibility. Health means diet and exercise.
Okay, I'm just going to repeat that for the reporting. So health is our responsibility, and health means diet and exercise.
Health is also that can fall. It keeps falling and falling. In my case, every year I have 1 or 2 new diseases. 45 of them right now. My health is not good. That's what I know about health. The health is very easy to lose.
That's an interesting perspective.
Any effort into losing it, it just comes. Sickness is attacking the system, and there is nothing you can do about it.
Yeah. So
Drinking, no alcohol, no smoking, never a bit, and my health is going down from the high top to the bottom.
thank you for sharing that. Yeah, so what was shared is that our health maybe decreases sometimes as we get older, and it feels like it's out of our control. We're doing all the right things, and yet it just feels like naturally things get worse. Maybe one more perspective if anyone has about health? Sorry?
Safe physical and mental well-being, hopefully.
Yes, yeah, that's really important. So what was shared is that health isn't just our physical health, it's our mental health as well. And that kind of goes nicely into the next slide that we're going to be talking about. So I think as we kind of described, health doesn't just mean not being sick or the absence of disease, but it's kind of this state of this like full holistic well-being on a physical level, on an emotional level, on a psychological level. And we know that there sort of are a variety of factors, as you're seeing on the right-hand side of the screen, that sort of influence our health. So we have our economic situation, the environment, and then as we've talked about, kind of our behaviors as well, the decisions we make every day, but also our access to health care plays a big role in this too. And so all of these things, again, come together to kind of shape the picture of each of our health. So on this slide, we're going to talk about some of the barriers to healthcare that have come up in conversations with folks in the community. So being able to go to a doctor, we know, is kind of a key aspect of being able to maintain a healthy life. Hopefully many of you have heard of a primary care provider or have access to a primary care provider or PCP, which allows you to schedule annual checkups, stay on top of vaccinations. But unfortunately, we've heard in the city of Boston that about 1 in 5 people do not have access to a PCP. And this number is higher in certain groups, such as men, people of Asian or Latin descent, and also recent immigrants. The question was, why is the percentage that's allocated towards healthcare or our PCP not higher on this chart? I suspect it's maybe because, you know, most of us see our like primary care provider for our physicals maybe once a year. So even though it's really important, something that we do every day, like the behavior piece, might have a slightly higher allocation for that reason, because it's just a bigger part of our lives. Does that make sense? But of course, I think, you know, however you're thinking about it is, I think, the most useful. Just knowing that it's important to go to the doctor, knowing that it's important to make these behavioral choices. The percentages, I think, maybe are a little bit, you know, personalized. So what was said was that socioeconomic factors also play a really important role in this. I think this is meant to just be like a rough sense of how we can view things, but I appreciate that everyone is bringing up your own personal experiences and thinking about how this could be modified or tailored to your reality. So as we were talking about, and I think on this last slide it alluded to as well, there are a host of barriers that exist. Some of them are socioeconomic, things related to the cost of visits, transportation, having to miss work sometimes to go see our doctor. And the last barrier I'll talk about also is just ensuring that people's language needs are met, since we know that that can also, you know, making sure that you're able to communicate with your provider is also really important in getting access to health. So now we're going to move on to thinking about specifically health as it relates to cancer. So our risk for cancer is kind of shaped by many different factors, as we see on this slide. Things coming from the environment, as well as our genes, and then those decisions that we make every day kind of all coalesce to shape our own individual risk and chance of getting cancer. So some of these things, of course, are out of our control, like the genes that we're born with. We don't really have control over that. Sometimes things in our environment as well. But fortunately, the decisions we make every day is something that's completely in our hands. We have a lot of power in shaping our destiny there. So that's going to be the focus of our presentation. So the first health behavior we're going to talk about is smoking. Smoking is one of the leading causes of lung cancer, with about 90% of lung cancer being attributed to smoking. But my question for you all is, can you think of how many other types of cancer are linked with smoking? Larynx and throat, yes. So things like secondhand smoke exposure, thank you for bringing that up. Things in our environment like radon, asbestos, those have also been found to be associated with increasing our risk of getting lung cancer. But any other stomach cancer, I believe that is also on the list, yes.
Heart disease.
Heart disease, so heart disease is kind of separate from lung cancer, but maybe there is a connection there.
Mouth cancer.
Mouth cancer, yes, I believe that is also there. So in total, there are 11 different types of cancers in addition to lung cancer that are linked with smoking. So you can kind of see on this chart, it's sort of spread across the body. It isn't just like concentrated in one specific region. So smoking really does have this dire impact. And it doesn't just increase our chance of getting cancer, it also weakens our body's ability to fight cancer cells if we were to be diagnosed with cancer. But the good news is that smoking rates overall are decreasing in Boston. So only about 12% of households report smoking, but we do see higher rates, unfortunately, in certain neighborhoods. On this next slide, we also see that Massachusetts has one of the lowest smoking rates in the country, with only about 9% of people reporting smoking. But as you can see, the rates are a little bit higher in Boston. So about 11% of Boston residents report smoking and 7% report vaping. And if you or anyone in your family needs access to resources to help try to quit smoking, here's some information from the Department of Public Health. They offer counseling and a host of resources in different languages, which is really nice to make this accessible to people of all backgrounds. So the next health behavior we're going to talk about is drinking alcohol. So my question again for you all is, which cancers are linked to drinking alcohol? Kidney, liver, stomach. So colorectal, I believe, is one, but stomach, we're not, there hasn't been a link established yet. Pancreas also is one that there hasn't been a link established, but that's not to say it doesn't exist. So I'm going to turn to the next slide. So there's about 7 cancers that so far research has established a link with. So this includes the breast, liver, bowel, larynx, esophageal, mouth, and throat. So you can kind of think of it as all of the different regions of the body that alcohol typically passes through when you drink are sort of currently found to be affected by this. And this does include all different types of alcohol, so red and white wines, as well as beer and liquor. And research also shows that the more we drink, the more our risk of getting cancer increases. This isn't to say if you drink like once, like immediately you're going to get cancer, but we like to think about how can we reduce our intake in our everyday life. And on this slide, you can also see some resources that are offered nationally by the Centers for Disease Control, the CDC, as well as there's a PATH program that the Boston BPHC, which is the Public Health Department in Boston, offers, which is available to folks in all of Greater Boston to help those that are interested in kind of reducing their alcohol intake. So this slide kind of just helps us think about, people might be wondering, so what does it mean to be drinking heavily? And we sort of define this in terms of binge drinking, is one definition, which for females means that you're drinking 4 or more drinks on one occasion, or for men, that's 5 or more drinks on one occasion. And then heavy drinking, for women, this is 8 or more drinks in a week, and for men, 15 or more drinks. And as you can see, about 1 in 4 Boston residents report binge drinking, and 1 in 12 report heavy drinking. So this is still kind of a problem that exists in our community. Okay, shifting gears. So I know the last two health behaviors we've been talking about with smoking and alcohol, those are things we're trying to think about. How can we kind of lessen in our day-to-day life? Exercise, however, is a health behavior that we want to think about. How can we get more of and really increase, since it has some really powerful benefits? So regular exercise is associated with a lower risk of cancer, healthier weight and BMI, and just better health outcomes overall. I know we were talking before that health isn't just our physical health, but our mental health, our emotional health, and exercise really can help with all of those things. Studies have shown that exercise may help reduce the risk of reoccurrence in people that have been diagnosed with cancer. And then also, as we've said, it can help reduce anxiety, improve mood, with our sleep and things of that nature. Unfortunately, though, not everyone in our community has reported that they are exercising to the threshold set by the CDC. So that threshold is sort of based on the type of exercise that you do. So if you do moderate forms of exercise like moderate forms of exercise like walking, that typically requires about 2.5 hours per week. Whereas if you do a more intense form of exercise like running or swimming, that only requires about an hour of 15 minutes per week. And we know that can be a hard threshold to meet. So the goal is to just start making small changes. If you can even think about incorporating 10 minutes of movement or exercise every day and working your way up from there, even that can have a really strong impact on your life. Oh, sorry, actually, before I go on this slide, I wanted to also just acknowledge that we know that there are many barriers that can get in the way of people exercising, having access to a place to work out, with rising costs of gym memberships, or we know during the winter months also it can be really hard sometimes to exercise when it's cold outside and there's not enough daylight hours. So it can be great also to talk to your primary care provider just to make sure that you're approved to do different forms of exercise. And then you can also find resources on YouTube. There's like a walk at home series that folks might be familiar with that allows you kind of just to walk from the comfort of your own home while getting to see like different sights and things on the video. But in recognition of the fact that it can be helpful to brainstorm with others in terms of figuring out how and where to exercise, I thought again I would open up a question to all of you and see if you all had any suggestions you wanted to bring up for ways that we can get an exercise. Yeah, so what was shared was that walking is probably one of the most convenient forms of exercise since it doesn't require having to, put on different set of clothes or shower. And I like the idea also of finding different routes. Sometimes we get sick of walking the same route, so finding a new route, or sometimes if you need to get somewhere, commuting there by walking maybe can be a nice way of getting that exercise in. I like, again, keeping it entwined with our normal activities like running errands. So the next health behavior we're going to talk about is in terms of nutrition and our diet, which is another thing we can think about in terms of things that have a positive impact on our health. So what is the connection between weight management and cancer specifically? Well, having a higher weight, unfortunately, can increase our risk of certain cancers. We know that excess body weight is linked to an increased risk of many cancers, including breast cancer after menopause and even colorectal cancer. But eating a balanced diet can lower our cancer risk and improve our overall health, and maintain a healthy weight for ourselves. So as we can see on this slide, over half of Boston residents reported being overweight or obese, and unfortunately this number was larger in certain communities like the Black community and the Latina community. But we are introducing some healthy swaps, kind of in thinking about what are some like small everyday decisions that we can make to kind of take charge of our health. So some examples of these are, instead of eating refined grains like white bread or white rice, we could eat whole grains or beans and vegetables. It's also important to get different protein sources like fish and chicken, but maybe eating those instead of having red meats or processed meats. And then also thinking about kind of in general how we can reduce our intake of processed foods and avoiding sugary beverages. And then on this slide, kind of in recognition that food insecurity and just access to food can sometimes be challenging among certain communities, I wanted to just share some resources that exist in Quincy. You guys might be familiar with many others since you all are residents of the city. But the first program comes from the Quincy Community Action Program, which hosts a variety of different resources. One of them is at the Southwest Community Center, which offers a food pantry, but also assistance in menu planning. They also offer a mobile food pantry, as well as assistance if people need to apply for SNAP benefits. And then another option is the Quincy Farmers Market, which is going to open up at the end of June and runs all the way through October. And they also accept a few options for financial assistance as well. Great. So with all of those kind of pieces in mind, in terms of thinking about our own individual health behaviors, we're now going to kind of zoom out and think about sort of what is the picture of cancer in Boston. So the first slide we're going to talk about covers cancer screening. So let's first define what is cancer screening. So cancer screening means to check our body for signs of cancer before we have any active symptoms. And usually doing this is really advantageous because if we do find signs of cancer, we're able to treat that cancer at a stage when it's more easily treated. And currently, we're able to screen for many different types of cancer. So this includes breast, cervical, colorectal, and prostate cancer. So for breast cancer, you can get screened with a mammogram. For cervical cancer, you can get a pap smear. For colorectal cancer, colonoscopy is one option. There are some other options that have also become available in recent years. And then there are PSA tests for prostate cancer. So these are tests that are accessible to everyone, but we also have screening tests for lung and skin cancer, but these are typically only available for those that are high risk for these. And if you're wondering, what does that mean to be high risk for lung and skin cancer? For lung cancer, typically it's people who currently smoke or have had a history of smoking in the past. It can also, as we've talked about, if you've had certain environmental exposures like secondhand smoke or radon or asbestos, you might also be eligible to be screened for lung cancer. And then for skin cancer, this is for people who have had bad sunburns or have been in tanning beds. If you've had a family history of skin cancer in your family, you might also be eligible for skin cancer screening. But of course, going back to kind of our initial conversations, a lot of screening is shaped by conversations with your primary care provider. So it's really important, again, to have those visits and talk to them about sort of what is the best screening tools for you, when is it best to get screened for many of these different types of cancers, since we know that again, each person, depending on your family history and your personal history, might have different recommendations. So for instance, for prostate cancer, men that are of African ancestry typically have a higher risk of getting prostate cancer. And so we recommend they start having conversations with their doctor at 40 to talk about getting screened, whereas for the general public, we typically recommend 45. So now looking at some of the cancer rates that we see in our community. So cancer unfortunately remains the leading cause of death for Boston residents, and this is followed by heart disease and unintentional overdose. Even though we're unfortunately seeing an increase in the number of people that are getting diagnosed with cancer, overall the number of people that are dying from cancer has decreased in the last 12 years, but there has been a little bit of a plateauing. So even though it's decreasing, it's kind of leveling off a little bit. Lung cancer is diagnosed more in the state of Massachusetts than it is nationally. So in the state of Massachusetts, 58% of people are getting diagnosed, whereas in the whole of the US, it's 54%. That's the number of people that are getting diagnosed, I believe, after getting screened. So of those people that I mentioned that are high risk, because not everyone is getting screened. Yeah, that's a really important distinction to get cleared out of the way. Of those people that are getting screened, I think 58% are being diagnosed. And then breast and prostate cancer tend to be the cancers that are the most commonly diagnosed in the Boston area as well. So just thinking about, again, the fact that cancer doesn't affect everyone equally, this slide talks a little bit about some of the disparities that we see. So amongst communities of color, low-income residents, people with disabilities, those from the LGBTQ+ population are disproportionately impacted by cancer due to access to screenings and the socioeconomic factors that we were talking about before, like if people don't have access to a primary care provider or not getting regular checkups, those can kind of exacerbate some of the trends that we're seeing. So you can see, like, as an example, Black residents continue to experience the highest rate of cancer incidence overall, and they have a significantly higher mortality rate from breast cancer, prostate cancer, and liver cancer. So the good news is that places like Dana-Farber are trying to address some of these cancer disparities as well as the realities that we see related to cancer. So on these next slides, I'm going to talk about some of the programming that we offer, and you can try to think about whether or not any of these are resources that you would like to access or things that you think might be helpful for your family. The first is our mammography van that you might see out in the community. Again, since we know that breast cancer is one of the most commonly diagnosed cancers, we developed this van to try to make breast cancer screening more accessible. So this is something that starting at the age of 40, women can access. Typically you need an appointment, so I've included a phone number for folks to call if you're interested. And they typically have appointments Tuesdays, Wednesdays, and Thursdays. And they go out to a host of different locations around Boston, and I think sometimes a little outside of Boston too. And then another option for breast cancer screening is a suite that we have at the Whittier Street Health Center in Roxbury. And this is kind of a more like permanent site that folks can get their mammographies done at. And ultimately what we like to say is that it really doesn't matter where you get your screening, but that you just choose to do it, since we know that typically about 3 out of every 1,000 people who get screened gets diagnosed with breast cancer. So going back to kind of addressing some of those smoking rates that we were talking about earlier, we have developed a tobacco treatment program that's located at Whittier Street Health Center. This program provides counseling and other supports like nicotine patches and incentives to help people quit smoking. This is our team member Sabrina, who performs this resource, and folks that are already patients at Whittier Street Health Center can typically be referred to this program by their primary care provider. And then the next program we have is our Sun Safety program. This is also through one of our vans that goes out into the community. Typically, we have a team of dermatologists, health educators that go out to beaches and other health fairs. And for this, you luckily don't need an appointment, but you can check out our website to kind of see what locations we'll be at and get a skin check on the van. And this program is seasonal, so it's only available typically during the summers. So definitely take advantage of it if it comes out to a location near you. The next program we offer is our community outreach and education program, which is the team that I'm on. So this one is near and dear to me. This program is really focused on, I think I was talking to some folks before we started the presentation about the fact that education is crucial in kind of helping us prevent cancer, since we know that screening guidelines are constantly changing and there can kind of be a lot of misinformation out there. So often knowing like what to do, when to get screened, can be very confusing. So our role is kind of hopefully to help clarify and demystify some of what exists out there. So we kind of partner with some of our faculty at Dana-Farber to bring them out into the community. We also perform educational talks like this. We go out to different health fairs to have one-on-one interactions with folks in the community. And a big priority of ours is also delivering our education in many different languages, since we want to ensure that our information is accessible to folks of all backgrounds. So we offer our programming in Spanish, Haitian Creole, Mandarin, and Cantonese, as well as English, obviously. The next program we have available is a new one that recently opened at Dana-Farber. This is called the Centers for Early Detection and Interception. And this was created in recognition of what we were talking about earlier, that everyone sort of has a different sort of risk for getting cancer. Some folks are at higher risk based on their family history or other personal risk factors, like having certain conditions that put them at a higher risk of cancer. And so this clinic was kind of established specifically for those that are at higher risk. So if you're interested, you can learn more about what we do, who we treat, by scanning this QR code. And then I also included the phone number that you can call to make an appointment. And then the last tool I wanted to share is a free online quiz that you can take to assess your risk for breast and ovarian cancer. This is a quiz that's available to people of all genders, for anyone over the age of 18. It is a quick quiz that you can take to kind of, again, understand what are your personal risk factors, what things are sort of protecting you perhaps from getting cancer. And then it provides at the end kind of a personalized action plan. You can also print out your results, take them to your next primary care appointment, and have a conversation with your doctor about any kind of modifications you might want to make. And before I finish, I just wanted to make sure to recap kind of all that we've talked about, since I know I've thrown a lot of information at you all. So just to give a quick little summary. So we started our presentation by examining some of the different factors that contribute to our risk of getting cancer. So these include the environment, our genes, and the health decisions we make every day. We then zoomed in on 4 specific health behaviors that we have the power to change. So that was thinking about our alcohol intake, avoiding smoking, exercising regularly, and eating a nutritious diet. We then talked about the importance of having those annual visits, being seen as needed by your primary care provider. And then lastly, we also talked about some programming that exists at Dana-Farber. I also shared some resources in Quincy as well that you might be able to access. So just, staying informed about what's out there, what resources can really work towards improving your health can be very important. And then this is just also a summary of some of the different programs that we talked about with links and phone numbers in case you want to quickly snap a picture. But thank you all so much. You've been a wonderful audience. I appreciate all of your active engagement with sort of the questions I asked, and I hope you were able to learn something new today about how to prevent cancer.